Good morning, everybody. Just waiting for this to join. Oh, hi, there.
Hello, good morning.
Just add Stephanie. Hi,
Hey,
Elena.
Hey guys.
Just waiting on David.
Hmm. Can you guys say something? I'm wondering if something's up with my speaker. I can't hear too
Can you hear me?
hi,
video.
hello. Welcome to my YouTube channel.
Yes,
Yes,
sir.
I heard that.
Can you guys hear me okay, too?
Yeah, I can hear.
Okay. Let's see.
Definitely need to get a new phone. Oops.
Something is happening. I can't accept. Okay.
Hey
Okay.
everybody.
Hi, David.
I thought I was going to be the one today, Simone, who couldn't get on.
Right?
I love this setup, David. It's very
Thanks so much.
nice.
Yeah,
Thank
his
you.
setup.
Thank you.
How are you
Yeah.
guys doing?
Yeah, pretty
Not
good.
too bad. Might potentially take off either my video or my mic so that I can cough or sneeze. Just
No
letting you guys.
problem. No problem. Okay.
It's a
So,
bit of a situation over here.
That's fine. That's fine.
understandable. So we'll give a few more persons to join, but good morning, everybody. Welcome to day 2 of our Caribbean Youth Mental Health Call to Action Instagram Live series. It's the second and final day. So today, well, I'll wait until the persons come, then I'll go into what we have planned. So we'll give persons a few more minutes. While we wait, we're talking about a Caribbean call to action. So put your flags in the comment section so we know where you're from.
Oh my
If
god.
you're representing two flags, like here, and if you're living in a non-Caribbean country, that's fine too. So, put let's see Trinidad. Trinidad, I'm from Trinidad too, so yeah.
Now I'm gonna find a Barbados flag. There we go.
Lovely. Barbados, Trinidad, UK.
Oh, we have
You
Antigua
got the house.
and Guyana. Nice.
Starting bypass.
Sure.
Grenada. Oh, Grenada in the house too. Guyana.
Oh, we have Grenada.
Mhm.
Oh, okay.
Hey, Claudia.
Welcome, everybody.
Wow, this is nice. This is very
Yeah.
nice.
Mix of people here.
Okay, we have another Trini, my fellow Trini brother. Who is this? Nice, welcome.
St. Lucia's in the house.
Hey,
Mm.
this is good, especially since it's a Caribbean call to action. This is perfect.
Exactly. Yeah.
As much representation as possible.
Share the live to some of your friends. Just send them it and tell them to log on. Just
Mm-hmm.
send them. Yeah.
Dominica's in the house.
Just spend this
Dominique.
Saturday
Dominique.
morning with us. Okay, so it's 5 past now, so I'll get started. So again, welcome everybody to day 2 of the Caribbean Youth Mental Health Call to Action Instagram Live series. Welcome to our panelists this morning. We have Claire Cook, Junior, David Jensen, and Elena Gomez. I'll go into a brief biography for each person shortly. But today, in today's session, we'll give a recap of the call to action, and we'll be discussing the potential impact of the call to action if it's implemented on communities and within the Caribbean region. So, just to do a recap of let me go into the panelists. So first we have Miss Elena Gomez. She's a counseling psychologist who has a passion for mental and physical health. She obtained her Bachelor's of Arts honors degree in psychology at York University in Toronto, and a Master's of Science degree in counseling psychology with a distinction from University of the West Indies, Barbados. These panelists have a long list of accomplishments, so I'll just keep it brief. And then we have Mr. Pierre Cook Jr., who's a health and human rights advocate in Barbados, the Caribbean, and further. He recently completed his Bachelor's of Law at the University of the West Indies, KFL, and he will be pursuing a legal education certificate at Hugh Willing Law School before he is called to the bar to practice law in the Caribbean. And then we have Mr. David Jensen, is a 24-year-old student doctor and mental health advocate. His guiding principle is to be the change you want to see, recognizing that change is born out of frank conversations and decisive action. David founded Let's Unpack It in January 2020 to empower Caribbean youth to speak up about mental health, challenge stigma wherever it stands, and to make mental health a lived reality for all. So, with that, thank you, both of you, or three of you, for coming and joining us for this session. So in today's session, as I said, we'll give a brief recap of the call to action. So really, this call to action, we are calling on our policymakers, our governments, mental health professionals, advocates to prioritize 4 key areas in order to tackle the mental health crisis in the Caribbean facing children and youth especially. So we're calling on the prioritization of leadership, research, regulations of policies and services. And these youth-informed solutions represent the collective feedback from youth across the region. So youth from across the region, they are speaking up and they're saying, okay, this is what needs to be implemented, this is what we want, and this is what would help, to improve the mental health situation in the Caribbean. So with that being said, I will now begin the discussion. So I would have just recapped the 4 areas that Caribbean youth are collectively calling on to strengthen mental health systems in the Caribbean. So I would go to Pierre now. How timely do you think this launch of the Caribbean Youth Call to Action, which is Monday, by the way, if you didn't know, and the push for this mental health call to action, how timely do you think this is?
Yeah, I think that I don't think we timed it correctly, but it just so happened that we all came together with, this idea to put together the call to action at the opportune time. Just last week, I think it was, I was scrolling through Twitter and people were talking about the fact that they've noticed that within the last year, they think that they've seen more young persons commit suicide than over the last 5 years. And I think it's really telling, especially since, coming out of the pandemic, and especially during the pandemic, the consistent message that we got from young people, the consistent cry was that, we are struggling with, our mental health. And in some ways, I think the pandemic was, dare I say, useful in exposing the gap in our mental health services. Now, before that, people didn't really pay much attention to, things like social anxiety or not being able to connect with your friends and the impact that may have on your mental health, or the impact that being in your house for a prolonged period may have on your mental health, or even consuming so much negative media may have on your mental health. But I found that during the pandemic, both young persons and older persons tapped into this language of, something isn't right with my mind, or, I'm not feeling too well up here, or this is really affecting me in a different way than physically. And so after hearing those stories and understanding from persons that they were struggling with even finding the language to explain what they're feeling, we then found out that they also struggled with finding resources to assist them with what they were going through. So I think after the pandemic, and kudos to the advocacy of everyone here and other mental health advocates, it was important that we kind of coalesce those experiences to fuel what we now have as the mental health call to action. And I think now more than ever, we really need to push this conversation. We really need to push the barrier and get the policy and everything implemented. Because dare I say, I don't want us to get too far down the line when mental health is no longer trending or a buzzword, because it seems that's when we only pay attention to it. When it's hip, trendy, when someone dies from suicide, that's when we really engage in the mental health conversation. So I'm hoping that we can really push this a bit further now that we're launching this call to action.
Definitely. And while the pandemic, has brought so much challenges and hardship for lots of people, it definitely presented a window of opportunity that I don't think any of us saw coming in terms of action on NCDs and mental health, just bringing those two things to the forefront, increasing the dialogue about it. And, I think this call to action really seizes that opportunity, that we, it's, for far too long, it's just mental health has not been given the financial and the human investment that it deserves, and especially, we're saying it's a burden, but, people are not putting their money where their mouth is, if I would be so brave to say. So definitely this call to action, I think, came at a good time. It could have been done before, but, everything happens when it's supposed to happen. So any other panelists want to share, how timely they think this launch is?
Yeah, I do definitely want to tap in here, Simone, and just to add that the other layer to the pandemic conversation was exactly what you just said. The idea that governments have not been taking mental health seriously at all. I think when we consider what stigma is at its root, and we consider that systemic stigma is a very real reality, I think the greatest manifestation, in fact, of the stigma is the fact that governments are failing to act. They're failing to take the mental health of young people in particular very seriously. And so what we've seen in the pandemic across the board is that whereas you ramped up the funding in terms of your primary healthcare, whereas you ramped up the funding as it related to testing, there was no ramped up funding for mental health services. And if we really consider what happens in a state of emergency, what happens when people are in a state of distress, we know that their mental health is one of those chief things that's impacted. And so in Barbados, for example, we had a situation where 1 out of the 1,000,001 press conferences that we had in the pandemic was dedicated to the idea of mental health. And further to that, we realized that much of the critical mental health services that are required were pretty much offline or downsized throughout the pandemic. And so one of the things we need to consider moving forward is not just what we do in a moment of crisis, but what we do when things are good, quote unquote. Yeah. And so what we realize is that governments on average across the world are spending less than 2% of their healthcare budgets on mental health. And when we look into what is actually being funded, it's the very bare minimum services. And that doesn't even begin to cover things like awareness campaigns and educating children in our schools and the reform that we need to take place in our schools in order for us to take mental health more seriously. And so I think what we should take from the pandemic is not just that in a moment of crisis, mental health is a concern. What we need to take from that is that if we had a good baseline mental health service to start with, perhaps some of the effects that we saw would not have materialized. And so what is required even now is a more holistic approach to health in general, because I don't want for us to continue to extricate mental health from the complete idea of health. And of course, we need more investment so that we can get more access.
So I kind of just want to add to what David as well as Pierre said, because I think it's important for us to recognize, as David was saying, that the government mostly acted because there was a crisis and something needed to be done in that particular time, but there was nothing done before. And I'm sure we've all heard, the saying that prevention is better than cure. So I feel like now, especially in Antigua, Pierre, you alluded to the fact that suicides increased during the pandemic. And we saw that a lot here in Antigua as well. And it kind of really showed that the government and just the country on a whole did not have the services or the consultants to kind of reach out to look to them and say, well, we have this amount of people who want to commit suicide or have been reaching out and need some help. Can we lean on you to offer them services? It was more of I have no idea what to do. And now we have to try to figure out what our plan is going to be, try and figure out what type of framework we can develop now in the midst of the crisis, as opposed to of being prepared beforehand for something like this.
Yeah.
And so I think that it's important for us to recognize that while, the pandemic came and the call to action, of course, I think is coming at an opportune time, because it is further solidifying the fact that we need to have a plan and we need to implement policies as well as other strategies, interventions, call on mental health practitioners from now, just in case something happens, or just in case people just want to reach out for help. They just need to know what they can do and how to make it happen. And I think the call to action very nicely and very simply puts how it can be done once we, as David said, look at it as a holistic perspective and also look at it as a multi-sectoral perspective. Because we can't just look at it as the Ministry of Health. No, it's all ministries. It's all organizations, NGOs, all of us need to work together.
Definitely. Alaina, as you were saying that whole multi-sectoral, multi-stakeholder approach, I think, yes, we need governments and policymakers to, bring about this change in policy, but it also speaks to, individual and community responsibility. So, youth organizations, CSOs, youth advocates, just like this conversation that we're having now, just, on the ground, trying to reduce stigma, increase awareness, and just make known the services that are available and that should be implemented. So I definitely want audience members to, kind of share in your country what services you have seen come up during the pandemic, rather, because it's not post yet, compared to before, how I guess the environment has changed in terms of mental health and the services that are available. So I think that is a good way to lead into the next question here. So, we're calling on our governments and policymakers for change and commitment to mental health in the Caribbean, particularly among our youth. So, in your opinion, why should they listen this time after years of inadequate intervention and commitments provided compared to, other lucrative or seemingly lucrative priorities like tourism? The Caribbean is a heavily tourism-based economy. Climate resilience, that's especially in the wet season right now, the hurricane season. That's a lot of research and talk is on that, and even on physical health care. So I'll start with here. This question we can go around.
I don't know, why shouldn't they listen? I think that for a long time, our governments have lip service, and in some instances, no service to mental health concerns across the region. And I think, and it feels kind of just dirty to put it this way, but our governments are fueled by productivity and having our persons, produce what they can do for the economy, how we can help, the economy of our different countries to improve. And I think we understand or appreciate. It's the simple fact that if your mental health is not at its optimum standard, then you're not able to be your most productive self. And so you're not able to contribute the most to society or to the economy, whatever they're looking for. But I think just at the basic level, it is a human right. Your access to mental health services, your access to mental health care is a basic human right. And so just because you're entitled to this, governments should ensure that they put measures in place to ensure that our mental faculties are all protected and cared for. I think when we understand the role of governments, they're necessarily caretakers. So we can't handle the finances, individually as citizens. We can't handle the running of the country individually as citizens. So we put our faith and trust into these select individuals to run the country on our behalf. And we trust them to do what is best for us. And part of what is included in that is our mental health care. So I think listening now is something that governments have done, like a long time before. The cries did not just start. We've heard for years that persons have been talking about the stigma attached to mental health concerns. So I think even now today, after the pandemic, and we're seeing more and more conversations like this about it, why wouldn't they listen,
I also feel like it would be in their best interest to listen, because as Pierre said, as a result of what came out of the pandemic, they saw that there's a great need for mental health care services. And so why not? We're literally handing you a framework of what to do. We're not trying to tell you, oh, well, go and do something. We're literally showing you what you can do, how you can implement these policies, how you can get the research done, how you can implement them in schools and other organizations. We're literally handing it to you. So by giving this call to action, so why not? Why not listen to us and hear what we have to say? Because we're trying to help you. We're not trying to say, just here, you need to do this because we don't see that you have been doing anything. So try and figure it out. We're giving you something. So listen to what we have to say, because we've seen it, and some of us have maybe even experienced it, how necessary it is to receive mental health care. And all the countries in the Caribbean and just the world have recognized how serious this is. You're seeing the increase in suicides. You're seeing the increase in people who are depressed, people who are anxious, not just social anxiety, but generalized anxiety. There's so many things happening, and it's just going to continue happening until we actually try and do something. So why not listen?
And I think just to add to that, I think what we need to paint the picture of for the government is that there is a cost. There's a cost attached to not acting. The reality is that, particularly in the youth category, if we don't intervene, if we don't act, if we don't mitigate and prevent and treat, then these are young people who are going into adulthood and into the rest of their lives with challenges that are untreated. And so when we start to talk about, oh, what does the future look like? What does resilience look like? What does the world look like when you add on the layer of climate change and how that actually impacts one's mental health? What type of future are we really pushing for? And I also want to drive home the point that, none of this is new. Yes, the pandemic has reignited the conversation about mental health, but governments across the world, 194 World Health Organization member states, adopted the World Health Organization Mental Health Action Plan back in 2013. And they gave themselves the benefit of extending that from the initial 2020 target until 2030. And so why are you dragging your feet? The recommendations that we're making are not necessarily so new. But these are things that governments should have been implementing as far back as 2013. And so it must be that there is a disconnect in terms of what governments are thinking about mental health, in terms of what are the practicalities of it, how does it play out. It's not just about putting people in the psychiatric hospital. It's not just about giving people medications. It's literally about the function of the society in terms of how young people relate to their environment, how they relate to their peers. And so much of the social ills that we're seeing, I'm sure that much of the mental health professionals can point out the connection between those things and failure to act on mental health. And so what we must make abundantly clear for governments now in these coming months in terms of rolling out this call to action is that we need action now. We're at a crisis situation, and if we fail to act, it's only going to get worse. And hopefully that's what I hope the mental health call to action will achieve.
Definitely. Because we not only want, our governments to help with this, but, to raise awareness in the public about mental health. Because even though the pandemic has kind of highlighted all of these, there's still a stigma, there's still this discrimination that occurs with persons who may be struggling with mental health conditions. Example, in Trinidad, person who is, considered to have a mental health challenge, they would send them to St. Anne's or Ward 1, and they would think, these are things like crazy, mad. And, when I was younger, those were terms that I was using as well. As I got more educated and I, became more aware of how insensitive those terms could be, just having those opportunities to educate oneself really helps this movement in terms of mental health, not only focusing on the absence or the presence of mental illness, but just overall emotional health and well-being is so important. So, yeah. So if you're just joining us, welcome. We are just discussing, the impact, or rather how timely the call to action is. And so if you haven't heard, if you weren't here last week, the call to action is basically a document where we are calling on our policymakers, governments, youth advocates, youth organizations, mental health professionals to prioritize leadership, the four calls: leadership, research, regulations of policies and services to tackle the mental health crisis in the Caribbean and strengthen mental health systems in the Caribbean, especially towards vulnerable groups such as children and youth. So moving along, I want to go kind of individually now. So while we recognize the role of governments and how we're really calling on them, Alaina, as a counseling psychologist, what role or roles do you think mental health professionals play in, creating an environment in which, these four areas can be prioritized and made a reality?
So I think that we, as practitioners, and I'm going to say we because, well, I am one, so I'm going to put myself in it as well. So I think we truly need to add to helping to not further increase the stigmatization and help to normalize receiving mental health care practices, well, mental health care in general, by helping each other know that it's okay to get help. I think a lot of people don't recognize that it's okay to get help and also where you can get help. So, for example, here in Antigua, we've created a mental health directory so that the public can know a list of all the different mental health care practitioners who are offering services. So I think that would be a great way to start in your particular country. If you don't have access to something like that or something like that isn't created, that for sure would help with the accessibility portion. I think just knowing where and who to reach out to is important. Just being a part of the conversation and being a part of Instagram lives like this, putting yourself out there in the media, doing different talks, creating the awareness, as you were talking about, Simone, I think that in itself will also help. And also being willing to be consultants with the government and other policymakers, because essentially we are, so to speak, the professionals who know what is needed, what should be in these particular policies, if the policies are sound enough to go through. And I think that once we're a part of that conversation, once we are a part of the kind of the decision making, the policy making, and we're assisting, I think that in itself would be a great way to even just start because we are the ones who need to advocate for it. It's our field. So we need to be the ones to be a part of the conversation. So I think that's a great way for us as practitioners to start.
A follow-up question there, Elena. Do you think, because, without mental health professionals, persons can't seek the help that they need. And last week, I remember Trey mentioning the ratio of guidance counselors to students, that's a big issue. And then the kind of many hats that they have to wear not just providing, emotional, mental um, health services, but for career advice. And I know the call to action highlights this to improve the ratio of guidance counselors to students and staff, and even, the introduction of master's level clinical psychologists in the school system. So, do you think enough is being done to acknowledge the role that mental health professionals play, in tackling this mental health issue, like providing them opportunities, etc.?
So I don't think that they're kind of seeing how important the role is, and not just seeing how important the role is by hiring mental health care practitioners, but also giving them the resources that they need to do the jobs that they have to do. And what I mean specifically is, for example, even if you have a qualified mental health care practitioner, and I've been saying mental health care practitioner because it's not just counselors, it's not just psychologists. There are different qualifications that enable you to practice as a mental health care practitioner. So that's why I'm kind of using that broad term. But if you are placed, for example, in the government, let's say you are in the Ministry of Education, right? And so maybe the ministry is expecting you to do different tests on children for things like ADHD or something like that. How are you supposed to test for that if you don't have the tools to do that and the government isn't giving you the funding in order to purchase those tools? You see what I'm saying? So I think that there's support needed with respect to funding and recognizing that we need the tools to do the job as well. I also think that because there is a huge problem with, as you were saying, the ratio of, students to counselors. There would probably be, maybe 1,000 students in one school, and there's only one, maybe guidance counselor. And maybe the guidance counselor, at no fault of their own, is not fully equipped with the skills necessary to handle such a large volume of students, or at least such a large volume of students who have problems that are coming to them. And so I think that in that particular case, they should recognize that, okay, we have one person here just physically, but we also need to find a way to outsource. I think that would be a good way in that the school will be able to give the students the necessary help, and the guidance counselor won't be burnt out with the level of work that they have to do, or feel as though, kind of get some imposter syndrome creeping in because they think that they're unable to handle the situations coming their way due to the lack of maybe skills or resources that they have. So I think that would be a good way to help.
I think, Simone, I just wanted to jump in there and say that the irony of the situation is that the mental health of our mental health practitioners is not being taken seriously. And so I do want to join Elena's call for mental health professionals, yes, to be mental health advocates, but I also want to call them to be advocates for themselves. Because when I sat and I spoke with 2 psychiatrists 2 days ago about some of the challenges that they're having in Barbados, it blew my mind. Because yes, of course, we have the psychiatric hospital. Yes, we know that we have the services available, but there's still a lot of resources, something as simple as medications. And, we talk about getting people back up to their level of functioning. Psychotropic medications are expensive. And I'm told that that is across the board in both public and private sector. So don't think that, you're escaping by not going to the psychiatric hospital to get those medications filled. And so something as simple as that, a critical tool that our mental health professionals need in order to carry out their job, is lacking. And then not to mention something that I know, of course, is throughout the entire healthcare fraternity, whereas they're working too long hours. And I'm speaking specifically about psychiatrists in public practice here, and other healthcare workers in public practice. They don't get to decide their own hours. And so when we're talking about providing a quality service, it's not just about, throwing money at the problem. We're talking about efficiency. We're talking about making sure that you have enough staff, making sure that you have the specialized care services available, or doing the outsourcing that Alaina is speaking about. And when we go through moments of crisis like we did in the pandemic, it's easy at the tail end to just go back to what we used to do before. But I think the the tools that we were able to utilize in the pandemic environment, namely online sessions. And I know perhaps it's not optimum for every single service, but where we can do some of these treatment or carry out the treatment plan via an online service, that would be useful. And so it's not just a matter, I think, again, of saying, oh, well, we need more guidance counselors in our schools. We need more psychologists in our schools. Yeah, let's put 10 here and 10 there. No, what we need is to bring all of our healthcare workers. I'm talking from community nurses all the way up to consultant psychiatrists. Bring everyone to the table because everyone has a part to play. And if we want people to roll out an effective plan, then they need to feel as though they're a part of it. And so as we contemplate what we're going to do in terms of implementing policies and strategies, we must make sure that we're taking care of the people who are going to be executing these kind of strategies.
So I completely agree with you, David, definitely. And I will also just put out there, because we are trying to destigmatize and normalize mental health practice, mental health care services. I have my own psychologist, like I need one. So, I mean, we need to normalize the fact that we all at some point maybe need to see somebody. And I really just want to point out here that you don't have to have a disorder to reach out to a mental health care practitioner. I think that that is such a common myth in our society. Like, you could literally just need help with time management and have to reach out to a mental health practitioner. You can reach out for almost any possible reason that would fall under the care of your mind, people, the care of your mind. And also, just to add to what David was saying, when you were discussing the fact that we just kind of need to bring everybody on board, I also want to input here the importance of training. So I think that if for whatever reason you cannot hire more healthcare practitioners in your school or organization or what have you, that's fair. Maybe you don't have the funding right now, but maybe you can utilize the one person you have to maybe train the teachers to try to address certain problems on their own, if possible, without sending everybody to you. So maybe you get the more serious situations if it comes to that. And the teachers have some sort of training to handle minor situations on their own if possible. So I think that could also be an option if, financially it's not feasible or something like that.
Yeah, definitely. Because especially when we're talking about children and young people, and just having the persons that they're around all the time be knowledgeable in mental health or psychological first aid is so important, because in some instances or some settings they may not be a guidance counselor or mental health professional, and or the school can't provide it, so the parents or the student will have to outsource it or pay out of pocket. So chances are they would not go through that route. So it's definitely important to train and to build the capacity of the teachers and the staff that are around children. Okay. So I will now go to David to tell us, as the president of Let's Unpack It and from a youth organization perspective, what role do you think youth organizations or in the mental health space rather play in creating an environment where these causes are prioritized?
Yeah, great question, Simone. And I think where we have the unique advantage is that we are literally rubbing shoulders, to steal the term, with young people who are going through these challenges. And so I think when you're in the age category that is primarily the target of this call to action here, I think we're in a unique position to roll it out. But what specifically can we do? I think in several youth organizations, and I've been seeing this trend, there have been increasing levels of talks about mental health, and I'm very happy about that. Just over the last 2 years, the number of youth organizations that have invited us to come and speak to them about mental health alone, that suggests that people are concerned about it, and it suggests that we're stepping in the right direction. But beyond that, I think what we need to do is to increase the level of awareness. And when we talk about awareness, it's not just simply knowing, okay, well, these are the signs to look out for. Yes, it's okay to seek help, but also informing young people about what services are available. And I think for a lot of people, prior to the pandemic, there was that level of disconnect. Well, yeah, I'm feeling this way, but where do I go? I can't go to my parents because they'll tell me that when they were children, they didn't experience this. I can't go to people in my church because they're not comfortable talking about mental health and they'll just tell me to pray. Well, who do I go to? And so I think what we've been trying to do is to provide people with that information. Well, hey, you know, it's a good idea to see a mental health professional about this. Here's a list of the mental health professionals. Moreover, we are calling as a mental health advocacy group for intentional action around the matter of suicide prevention. And I think too little has been done. You know, every couple of months, and I've been observing this, every couple of months, we get this thing thrown around. Oh, the hotline is coming soon. Oh, we're going to restart the hotline. Oh, well, the number of young people accessing mental health is increasing, so maybe that's encouraging. No, we can't operate in this sphere of maybes. And so that's why, for instance, the call specifically about research is so important. When you type in mental health in Barbados in Google, the first thing that comes up is not a study from Barbados. The first thing that comes up is not UE Cave Hill's study. And so what we need to have is the research being done so that it can inform the policies and strategies that we want so that we're not guessing. And so specifically on the matter of suicide, what we are calling for is specific action to mitigate it, specific action to understand what are the risk factors and the causes that are unique in the Barbadian or the Caribbean sphere. And so we can use that to take the action that is necessary. And so if I think, and by the way, for anyone listening, we do have a suicide hotline that is up and running, 264-7151. If you look in our link in our bio, you'll see all of these resources available. But I think if we keep dragging our feet on these kind of matters, we're not going to get the progress that we want. And so what we're going to have to do, as I've been hearing a lot, is to get on the streets and make some noise, honestly. And so if that's what's required, we're going to do it. But I think when we look at the role of youth advocates, primarily it's going to be in this phase right now, the idea of awareness, the idea of education, the idea of mental health is your human right. It's something that you deserve. It's something that you should want. It's something that we should call for the government to take action on. And therefore, as we get closer across the Caribbean, especially towards election time, I imagine that the role of the mental health advocates can be to make this a matter that comes up in the election, make it a matter of voting, make it a matter that young people say, well, if we don't get action on this, you're not getting my vote. If it's not in your manifesto, it's not even up for consideration. Because the reality is, and I hate to put it so bluntly, but young people are struggling and young people are dying. And if that doesn't wake us up, I don't know what will, honestly. And so that's how I imagine our role. But I'm sure Pierre will have some other things to add to that.
Yes,
Yeah.
right.
The only thing I can add is that, value our lived experience. So, our struggles with mental health challenges, what we go through. And that is useful information to inform policy, that is useful information to inform our strategies, that is useful information for our government to implement here. One of the things that I think we don't talk enough about, and I raised it just yesterday, the cost of mental health care. And when you look at the cost of therapy, psychosocial therapy, when you look at the cost of the therapy and medication, it's incredible. I shared recently, very publicly, that on an average for a month, it would cost me about 500 Barbados dollars to invest in my mental health. And that includes therapy with a psychologist, psychiatrist, and then medication. 500 Barbados dollars is not something that everyone can afford to shell out every month. And then beyond that, if you're saying, well, go access the public healthcare services, the quality of that service is abysmal. And so, you see, there's this, discrimination of sorts. so that if you have access to better financial means, or if you are upper middle class or have the financial amenities, you can access quality mental health care services. If you don't, then you have to be struggling to get on the wait list to get your ADHD test. You have to be struggling to see a doctor at the psychiatric hospital. And even beyond that, you may only get one session per month, one session every 2 months, and sometimes persons need 2 and 3 sessions a month. And so the cost alone of accessing mental health care services is something that we need to have a big conversation about. And that is something that we can get from the lived experiences of young persons. More young persons coming forward saying, hey, Pierre says he spends about $500. I spend about $600. I spend about $300. And then you see, as David said earlier, there is a cost attached to mental health care. And unfortunately or fortunately, our governments, they speak in dollars and cents. So once you're able to translate the challenge in terms of the financial impact, maybe then you get them to engage in some increased action. So the role of young persons, the role of youth organizations, the role of youth advocates, really in this space is to share our lived experiences so that that can inform policy and that can inform what happens next.
Definitely. And I think that also speaks to the call to action we were talking about, including mental health services in insurance schemes, and just, having just community-based services where persons could access that are good quality, because usually the community-based ones, they're just, as Pierre said, very kind of limited in quality in terms of frequency, and not really tailored to, vulnerable populations, just a general person, just seeing everyone, kind of boxing everyone in. So definitely a more tailored approach is required. So I just want to kind of pick your brains a little bit on what do you think the short and long term outcomes that you're envisioning if this call to action is first of all acknowledged and implemented in your country, and because you're from a Caribbean perspective as well.
I guess I can jump off. I think the short-term benefit is that there will be increased awareness. If our governments decide today, tomorrow, next week, we're going to take up this mental health call to action, there will be this level of increased understanding of, okay, what is this mental health call to action about? Why do we need a mental health call to action? Is this really such a big problem? And so as we implement the call to action, we implement the policy action that we have, we can see that conversation in society about, mental health care services alone can help to reduce the stigma attached to accessing mental health care or to talking about mental health challenges. In the long term, a healthier society. In the long term, a better for our people. In the long term, a better world for our children. In the Caribbean, we have unique experiences. I was discussing this with NCD Child sometime before. When you look at the fact that a small island developing state, there's a certain period in the year where we have this anxiety. What period is that? The hurricane season. That is something that's specific to our experience in the Caribbean. So when governments invest in mental health care services, when they invest in this whole society approach, maybe then we can have a more comfortable society. And David alluded to it earlier. I want to make it clearer. It doesn't mean that government just have to go in and say, well, we're going to put in this this law that speaks to mental health care action alone. It's a whole of society approach. If they or develop more green spaces, right spaces, access to wellness behaviors, access to free yoga classes, all these things help to complement our mental health care or our mental care. So there are other things that can be done, other things that government can understand to help improve our mental health care. So again, short term, increase awareness. Long term, about society for people in children.
So just to add to what Pierre was saying, I think also in the long term, ideally, what I would love for all the Caribbean islands to have as a result of implementing the call to action is every school have a mental health practitioner attached to the school. Every business have a consultant that they can reach out to. Every government ministry have a mental health practitioner within the ministry, because let's face it, it's really not just the Ministry of Health and the Ministry of Education that need mental health care practitioners. Another aspect of the ministry that I for sure know needs some sort of mental health care practitioner is in the legal aspects of the ministry. We need that. What happens when we have sexual offenders, people who've been abused? What happens to them? That happens so many times. And then I know that, even here in Nancy in Barbuda, you try to reach out to private practitioners, and sometimes they might already be so overwhelmed with their load that they can't extend any further. And then a lot of the times it's, even though the person is willing to extend themselves, it's just, well, we need it to be done pro bono. And it's kind of like, well, of course we want to help and we will do some things pro bono, but you guys need to have somebody attached to the ministry or to the courts or to whichever sector is responsible for that. You need to have somebody. So that is just one example of where it's clear that you need a mental health practitioner. They're not putting the funding necessary there in that particular case. So yes, ideally a mental health care practitioner in many, if not all, organizations, businesses, and schools, I think would be a great long-term effect of putting the call to action in place. And I think also having evidence-based research in the long term, that we can pull proper interventions that have proven to work in the schools and in other organizations and just with people in general for specific areas of mental health. So like depression or anxiety, what techniques work in this particular age range or population or something like that. We need to have that in the Caribbean. Yes, they have them in other countries, but we need to see what works for our people. It's very different. And so I think that in the long term, those are some things that would be positive outcomes of implementing the call to action.
I definitely agree with both Pierre and Elena here. And I think the overarching theme of this call to action is the call for more investment. And I think this is one of the issues in our society, which it demands government leadership on this matter. Because, hey, if the government is investing in it, then people say, well, my money going into that, and so I need to care about this. At a very elementary level, that takes place. But beyond that, in terms of the long term, I think it signals the idea that we will no longer settle for mental health as an afterthought. Because what we're calling for is for mental health to be integral to every single policy, to every single strategy, to everything, such that we don't release, as has happened in Barbados, surveys and don't consider that young people's mental health may be impacted, such that we don't have a discussion about NIS and not consider that mental health has a part in that, such that we don't consider climate change without considering mental health. And so one of the things that I contemplate, for example, is that when we talk about emergency preparedness, that mental health, as Elena suggested, is integral to that. Not necessarily that you need to go about and do something completely extra, but such that it's on the plate, such that we say, okay, well, after this, then these are the services that are going to be required. And in talking with the two psychiatrists, Dr. Duglin and Dr. Rochester, two days ago, we came to the point that we had an understanding that you don't necessarily, if, like Elena suggested, funding is too much at the moment, there are other steps that we can take, such that when you talked about training the teachers in our communities, training people in how to provide basic emotional support, how to provide psychosocial support in a time of crisis, making sure that people who are struggling with their mental health have the adequate resources in a time of crisis, such that mental health has to be a part of the conversation about emergency preparedness. And, resilience is the buzzword going around. How can we be a resilient society if we're not catering for the well-being of our citizens? And so what we fundamentally need is for us not to just be having aimless conversations about mental health, not to be, you know, using mental health when it's opportune, when you want to pass a law about tax, that, you know, you put in a little mental health there and a little mental health there as though it's salt and seasoning. No, it's the very crux of the meal. And so, you know, we need to move from a position where, you know, we even have to have these conversations about, you know, well, will they take it seriously? You know, will this mental health call to action? No, we need to be in a position now where we have young people who are struggling, where we have young people who are dying by suicide. We need to wake up and say, well, hey, this is something that's serious. This is something that ought to be on the front row, not on the back burner. And so, yeah, that's my basic hope for this call to action.
Sorry, Simone, just before you, I just really wanted to add here and also ask the audience a question. As David said, a very popular theme here is the lack of funding that we seem to have kind of pointed out here, that the government either doesn't allocate it properly, or maybe there's no funding in specific organizations or schools or what have you. But I also just kind of wanted to know from the audience if you know if any insurance companies in your island offer insurance coverage for mental health care, because I feel like that is not the norm for insurance companies, and that is something insurance companies can take consideration into, because there are lots of people who possibly would like to receive mental health care, but as we were talking about it before, they're unable to maybe pay for it due to how much it costs or whatever their socioeconomic status is. And it would be great if insurance companies helped to aid in helping them to just get the services that they need by covering a certain percentage. I mean, I think that should be something that they take some serious consideration into, if possible. But it would be great to know from the audience if you know if any insurance companies in your island cover mental health care.
Okay, yes. So audience members, please. Oh, go ahead, David.
No, I don't have a direct response, but I did want to follow up. But go ahead, Simone. You finish your thought and then
I was just going to say, audience members, add the insurance schemes in your country that you know of in the chats. But yes, Steve, I was just going to read a question from the chat.
Yeah.
Okay.
Go ahead.
No, go ahead.
Okay, fine. Alaina made the point about insurance companies, and I just want to jump in because we were having at LUI, we were having a conversation recently, and it's the role that the private sector can take in this particular matter. And, you know, much that we talk about young people, they go to school, and so we understand that connection that young people should have access to mental health professionals while they're at school. When we talk about our adult population, which I think if we can't get it done here, then it's going to be very challenging to implement, I think, as well in the young people, because they rely on the adults to, you know, make their mental health a reality. But something that businesses can do, especially in the private sector, taking concern with their employees' mental health. And I know some private sector organizations across the Caribbean have been taking this seriously. There's this new term that I'm becoming very familiar with now. It's called ESG, in terms of environmental, social, and governance. And that social aspect, becoming familiar with mental health, the idea that when people come to work, they're not robots coming to work, but that they're human beings with challenges. And so respecting mental health in the workplace, putting in preventative measures in terms of avoiding burnout, avoiding stress, making sure, like Alaina was suggesting, that, you know, every business can be in contact with a consultant in the mental health field, making sure that you can host, you know, mental health days and so on. There's also good evidence that suggests that businesses which engage in voluntarism and altruistic behaviors tend to generally be better. And so what are the benefits that we're seeing here? If you invest in your employees, if they feel as though that their health is important to you, that their mental health is important to you, then of course they're going to feel a sense of loyalty, perhaps. They're going to have an increased value for the work that the company does. When they go and they talk with their friends, when they drink on a Friday evening, they're not going to lambaste your company and tell people don't come and work for this company because they don't care now about my mental health and I packing up and left here. And I mean, I think what we have to do is to walk people through these steps and to show them that there is a connection from mental health to all of these different facets of our life. And I think as long as we can do that, then our awareness and our advocacy is going to be effective, and that's going to translate into action. So I thought it was prudent to mention that, because a lot of times when we talk about men in a siloed way and we say, you know, put a little bit here and put a little bit here, what we need to call for, especially with this mental health call to action, is a holistic approach. Bring all the stakeholders together. Let's have a conversation, but not an aimless conversation, a conversation that amounts into action.
So we have a question from the chat. Akeem Rada, he asks, as an advocate for persons living with disabilities, how are you including persons living with disabilities in the call to action? So I will just mention something briefly on that. So in the call to action, we would have consulted with groups including persons living with disabilities, persons with NCDs, members of the LGBTQ plus and indigenous communities, ethnic minorities, religious groups, persons of low socioeconomic status. So we really try to capture those groups that tend to be quite underrepresented, especially in terms of policies relating to them, mental health, access to mental health services for these groups. So definitely they were involved and consulted with and we definitely value their feedback in the consultative process of the call to action. So if anybody wants to add anything to that, please feel free.
I want to thank you for the question, and then I was right. We did specifically in terms of the persons within the disabled community. We necessarily included this need for increased research around all challenges with this group. But what this underscores is the unique experiences first in terms of persons living with disabilities will have or have different express their mental health illnesses in a different way, more able-bodied. But I think when we look at even persons within the LGBTQ community, especially in the Caribbean, there are youth when you live shadowing your identity and with anxiety, developing symptoms of depression, just because the community is not so welcoming and accepting of who you are and how you identify. And so you know that there's a unique challenge that persons within that community face. So any call to action or implementation must take into consideration the unique challenges of groups as it relates to mental health. So I have further question just underscore that in developing the call to action, there was this commitment by that we communicated that we had meaningful engagement of persons across as many communities as we could have access to, or who are willing to.
And I think to further buttress Pierre's point, in contemplating what we're going to do moving forward, the call to action also talks about leadership, and leadership also taking place in the form of youth health councils and youth engagement, such that if we're going to measure, for instance, how effective is this rollout of this call to action, we need to be continually engaging young people. And so I think there is definitely room and space for us to have young people from across every background, from every identity, from every single category, essentially, to be involved in the actual implementation of this. And so what we're calling for governments to do is not just to see young people, but to see young people from diverse backgrounds and realize that they too have something to add to this conversation. So yeah, I thought that was fruitful to point out.
Elena, anything to add there?
Oh, no, I think everybody answered perfectly, actually. The only thing I wanted to say is that that was an excellent question, because I think that a lot of the times we, as people, not intentionally, but sometimes when we're doing specific calls, we leave out persons with disabilities. And I think it's great that the call to action did consult people with disabilities in this particular initiative, because it is important and it is a community that we do need to help, because we all should have access to mental health care. There's no health without mental health.
Okay, Elena. And regarding your question that you posed to the audience before, it seems like not a lot of Caribbean countries have, insurance plans, insurance schemes available. I'm seeing Sagicor and Barbados has. Um, it seems very lacking based on the comments.
Yeah.
So yeah, I'm not even sure what if Sagicor here has it. I should probably
See, there we go. I mean, so far it's just Sagicor and Barbados and Antigua.
yeah.
Muhammad said they didn't know of anywhere, and I'm assuming the persons who aren't responding in the chat aren't responding because they don't know. And it's not common knowledge, and it's also possibly not something that's offered. So as David was saying before, we need to call on the private sector for sure to start helping our people find ways of accessing mental health care. And that's one way that they can do that. If it is that they have an insurance company, if that's something that you could include in your policy, why not?
Definitely. So just to kind of wrap up the conversation, I thought, we're always hearing this phrase, to build back better post COVID-19. So with this in mind, how can we apply this concept rather to the state of mental health in the Caribbean in terms of attitudes, access, and level of awareness or literacy in terms of mental health?
I think when we say build back better, we're often working from a place that there's already been a solid foundation. I think in terms of mental health, we actually need to build the foundation. So we're now starting the building. So it's more so let's start building, then maybe later we can talk about building better services. Because that suggests that there's something that's there that is already of a certain quality, but we just want to improve it. Right now, I think the lack of services, the lack of funding, the lack of comprehensive policies, the lack of comprehensive intervention means that we need to start. I do believe that this mental health call to action is really a concise way to coalesce what persons are asking for across the region, just how governments can begin to lay that foundation for improvement in health care. To come back to something that we mentioned earlier, the effect of this call to action may not be seen immediately. It may not be seen within the next within the next years. We start to see or reap the fruits of it, but we just put that word. Some person's going to set for or breakthrough until that mark. Even persons who are medicated, it takes a while for that to become effective. So I don't want people to think about the mental health call to action as to fix mental health challenges, but necessarily so that within a couple of years, within some improvement or reap some of the fruits from in terms of healthcare.
Yeah, and I definitely think to follow on from Pierre, it's imperative for all of us not to rest on our laurels. We can often think of these things as the grand finale, but it's not. This is literally the beginning. And so as Pierre is talking about, literally laying that foundation. And as Dr. Rochester told me 2 nights ago, it's all about, our focus needs to be about creating that quality baseline mental health service. And it's the same thing here. Like, that's what we need. Like, a quality baseline mental health service will be adequate for young people. It will be adequate for older people. It will contemplate much of the challenges that we are facing in our current climate in terms of natural disasters and pandemic responses and these kind of things. It will also contemplate the fact that there are social factors that impact on a person's mental health. And so when your government thinks about mental health, they must think of things like poverty. They must think of things like housing. They must think of things like parental training, because you can do all you want at the school. You can give the child all the care they need, but if they're going back into a household that does not care about mental health, that does not respect mental health, then what gains are we making? And so what we need more than ever is a holistic approach that we keep calling for, but we haven't seen it practically. And what I need everyone on the call to do, what we need everyone on the call to do, is to make mental health an issue. And so I'm not saying that everyone needs to take on the title of mental health advocate in terms of forming your own organization and raising banners and these kind of things. But at the individual level, make it a topic of conversation in your groups. Make it a topic of conversation between you and your family members. And too often, especially on the matter of suicide, we hear that, well, I didn't know. It's time for you to know. It's time for everyone to be aware and to know the warning signs, and to have the level of conversation that will make it seem as though mental health is a priority for all of us, and will also translate into us taking action to advocate for something that Pierre keeps driving home is a fundamental human right. And it really is, because when the WHO contemplates health, they don't separate it. They claim to view it as one holistic being. And so that's what we need to internalize. And so my hope from here is really that this is going to take root, that governments are going to take it seriously because we are going to take it seriously. And so I don't want us to divulge our responsibility. And yes, we do need the policymakers to effect the actual change, but they're not going to do that unless we make the noise. And so I hope that's the point that we'll all take away from this discussion today.
Just to add to what Pierre and David said, excellent responses, by the way. I think that just to build back better, as the phrase is implying, we need to, or the government and policymakers and all of us actually in general need to first recognize that there's a problem. Because we do have a problem, and the stigmatization of mental health is a problem, the lack of funding is a problem, lack of access is a problem, lack of policies is a problem, and the call to action very nicely lays that out. So we recognize what the problem is, and let's figure out what our specific role is and how we can help to ensure that the call gets implemented and to ensure that mental health care is taken seriously, because as Pierre has said, it is a human right, fundamental, and we need it. And so in order to build back better, we need to recognize that this is a problem. And as both David and Pierre have been saying, lay that foundation, create all of the different necessary policies, get research done, get the access, find the mental health care practitioners who are qualified that can help, get all of the resources together, and let's start working on this together, because we need it. All of us here on the call need it. The governments, they need it. We all need to recognize that it's something that we can all benefit from. And so why not listen, and why not put the call to action in place?
Definitely. So listening to everyone's contribution here definitely relates to the question that I just received from Joe Mindful Study. He's asking, do you think Caribbean NGOs and advocacy groups such as yourself should play a more active role in the generation of Caribbean mental health research as well? So I think definitely all of you touched on that, the importance of evidence-based policies, the importance of research regarding mental health, and not only actual research having to be published, but the work that each of you do on the ground in terms of mental health advocacy, offering mental health services. David with Let's Unpack It, with interviews on the streets that you did for Suicide Prevention Month. All of these qualitative approaches are important to get, those lived experiences, how people are feeling, and that could translate. Well, we're hoping that it could translate into more research, a greater priority in mental health research rather. So, if we don't have any more questions in the chat. Okay, and yes, Stephanie would have said, mentioned in the chat to continue the conversation by using the hashtag no health without mental health. That is the slogan for the call to action. So just to close, I would just briefly, in case you just joined, you probably don't know of the call to action. So this call to action is a document that we are calling upon our policymakers, our governments, mental health professionals, youth advocates, and the general public to prioritize 4 calls: leadership, research, regulations of policies and services. We believe that these youth-informed solutions would help to strengthen mental health systems in the Caribbean and help to improve the access, the affordability, and the quality of mental health services, and especially have a more tailored approach to the vulnerable groups, such as children and youth, in terms of mental health care. So with that, if just a reminder that the launch of the mental call to action is on Monday, the 10th. So stay tuned to HCC's social media pages. We'll be launching the call to action. We'll be launching the web page. We'll be launching. Oh, I did not tell you guys. You have a pledge coming out for the call to action. So that will also be available. So you can sign on to it and show your support. You can share it, and some other resources that we'll be sharing on Monday. So stay tuned. A lot of things launching. So make sure you share. And thank you to all the audience members for engaging with us today. Thank you to Pear, Alaina, and David for this riveting conversation. I'm sure everyone, left with something. And just to close, if you don't mind, if each of you could say just a line. If like someone from the audience is wondering, okay, what should I take away from this call to action? Just say one line that you think we should take away.
Use the line that we always use to close off our lives, and that's mental health is a priority, and it's really up to you to make it a lived reality.
Mental health is a human right. It's not a privilege for some, but it's a right for all.
Alaina?
Funny enough, the very first line that David said is exactly what I was thinking, because I always say that mental health is a priority. But I think what I really want to say is that, including with mental health, self-care is something that can be costless and you can do in 5 minutes. So if you really want to take care of your mental health, try and prioritize self-care practices.
Definitely. So those 3 takeaways are a good place to end off this live. Thank you all again for your time and for providing your insights on this topic and the call to action. And thank you to our audience members. Again, please stay tuned for Monday's launch of a plethora of things. So just stay tuned, and I hope you all enjoy the rest of your Saturday. Bye.
Bye-bye. Have a good
Take care, everybody.
Bye. Bye, everyone. Thanks for coming.